Maria did.
Okay.
Maria, you may have an opening in IT.
Okay, so it's all set now?
It's as good as it's gonna get.
Okay, that is great. So I will call the meeting to order. It is, in the interest of time, I will call to order. It is 1:38, I will say, PM, and I will call this meeting to order. We are recording to review, be reviewed later by members of the public, so they may see it, watch our meeting. And we do have a couple members here. Can you state your names for the record so we can put attendance in the minutes?
Laura Ibarra.
Yep.
Lindsay Lucas.
Thank you. I know you both, but it's, we have that in the minutes. Okay. So the purpose of this meeting is to hopefully finalize our review of the life-threatening allergies policy. I thank Mr. McAvoy for joining us. At our last meeting last week, we had a couple of questions about his comments on the policy and wanted to get some clarification and thought by having you here, hopefully we could have a clear understanding of what we need to be doing legally and make sure that we're meeting that. I don't know if it's possible to put, I don't know if it's possible to put the version we were looking at on the screen, but I can certainly start with what our last question was. When I opened the version that we were sent, it didn't have all of the comments that we were looking at last meeting. So, okay. Apologize. So I'm hoping that we can get that. It was it had some comments, but not all of them.
Okay, that's all right. That should be it.
Is that the right one? Because I don't see all of Matt's comments there.
I think if you scroll further down.
You scroll down there? Okay. I did not see them.
No, they're not.
I did not see them on there.
Got it.
So there's adding 2 additional legal references. That was yesterday. So that's since our last meeting. That was 2 days ago, Friday. That was since our last meeting. So it doesn't have the I mean, I wrote down what our question was, but I do not see all of his comments on there from the previous version. So let me ask one of our questions in the interest of time before we get to the actual text. One of our questions that we had to clarify is, are students, both your comments are about 504 and the plans and the language. So are students, or are we required as a district by law to have a 504 meeting for every student with a life-threatening allergy?
Upon receipt of information from parents, either through them directly or through their pediatrician, indicating that the child has a life-threatening allergic condition, my position as district, as council would be that would trigger our child find obligations under section 504 to refer that child for an evaluation of their eligibility under section 504 as a qualified individual with a disability. Because we are essentially being put on notice that the student may have a physical condition that is substantially limits a major life activity, be it either breathing or eating, when in full effect, and may, as a result of that, require accommodations or services to ensure their equal opportunity to access all of the school programming that's enjoyed by their non-disabled peers.
Okay, so in your legal opinion, you are indicating that we should trigger a 504 meeting for every student that notifies us that they...
No, I just to clarify, not necessarily a meeting, but I think that, upon receipt of information from parents indicating that their child may have a life-threatening allergic condition, we should be at least initiating the referral process and notifying them of their availability of an evaluation under section 504 and what their rights would be in that evaluation process.
Okay, so not that they're required to have a meeting, but that we are required to begin that referral process and at least let them know of the
Notify the parents of their right to request
right, yes.
of their child's eligibility for
Okay.
accommodations or services under section 504.
Okay.
Okay, so this is, can we ask if this is
Um,
irregardless of the protocols and the.
you can ask. It is, I am gonna go to a procedure. You can ask, but I, because of being remote, I did want to make sure people were raising hands this time just to kind of keep things flowing, but yes, go ahead and ask.
Oh, okay, no, I didn't know if you wanted to ask if I'm too far from the microphone. Okay, can you hear
go ahead.
me?
Yes.
Okay, so, hi, Member Brennan. So last week, our discussion was if, we know that all the children with life-threatening allergies are eligible or to a 504. But what we were wondering was if the, I'm sorry, I'm losing my words.
Procedures.
Well, so if
Protocols.
if the protocols for the life-threatening allergies that we have will cover all of those students' needs, and if the, what's the action plan called?
Allergy action plan. Allergy action plan
The health,
and or individual healthcare plan.
oh, and if the individual healthcare plan, sorry, covers the students' needs for their allergy, I guess the question is, do they still need a 504 meeting, or are they still always get a 504 meeting, or is it only if their needs aren't being met by things already in place? I guess.
Well, it's important first to distinguish kind of the stages of the 504 eligibility process.
Right.
So what my recommendation is that upon receipt of information from a parent or an outside provider, the student has a life-threatening allergic condition that triggers our child's find obligations to, inform the parents of their right to request an evaluation and to send them the paperwork for that purpose.
Okay.
If they request the evaluation, then we convene a 504 team and make a determination as to whether the student is a qualified individual under section 504. So whether they have a physical or mental impairment that substantially limits a major life activity, that life activity does not have to be learning to trigger our obligations to provide the student with protections in accordance with section 504.
Okay.
Breathing, walking, eating, anything. So if the team determines that the student does meet the eligibility criteria, then what the team next looks at is whether the student requires individualized accommodations or services to ensure their free appropriate public education under section 504. If the district has in place universal procedures that are implemented across all schools that essentially provide the interventions which would otherwise be requested on an individualized plan for the student. Our position would be that the student does not at this time require specialized accommodations or individualized accommodations pursuant to a 504 plan, because in essence, the district and school-wide policies are mitigating measures that reduce the potential dangers posed by the student's life-threatening condition. So in the 504 eligibility process, you first make the determination as to whether they're a qualified individual under section 504. Someone can be a qualified individual under section 504, but still not require an individualized section 504 plan, because in determining the need for such a plan, you can at that stage in the eligibility process consider the beneficial effects of mitigating measures in determining whether the student requires individualized accommodations.
So my question then is, in the policy that we have,
Yep.
currently, where you made your first comment, which I don't know if anyone can read what's up there, but I have the printed version in front of me. In the second, it was the third paragraph where it says the school nurse in conjunction with the parent guardian and the medical provider will prepare either the allergy action plan and or the individual healthcare plan for every student with a life-threatening allergy. The allergy action plan and or individual healthcare plan will be updated annually. And then the last sentence we had that students may also be referred for evaluation of eligibility under section 504. What I'm hearing you say is that that language should be updated, that last sentence should be updated in some way to say that, I don't know, I don't have the language,
Well,
but,
Maria just changed may to will.
Right.
Yeah, and I would agree with the change from may to will.
would that be clear?
That would address my concerns.
Okay, so that would be clear that it says will also be referred for an evaluation of eligibility. And then they would get whatever packets you send to them or.
Right.
Right, we would send an evaluation consent form to the parents with no
Okay,
right
great.
to provide.
So that solves that question.
Yep.
Your next question was about the details that we deleted underneath that. And I think that's where we very much appreciate you being present to help us think through that or explain that. Because we deleted a lot. I mean, we didn't delete it. It's stuff that is covered under our policies, or
Right.
not our policies, but it's under the protocols. And it's a lot of, and the law, honestly, a lot of it's in the law as well. And so we referred to those early in the policy that we are, in our amendments in this policy, that we would be following the particular law and the protocol, which I think cover a lot of this process. And so we just wanted to understand, now that we've changed the may to will, what your thoughts are on the portions we deleted.
I think as long as you change may to will, you're fine with the portions that are deleted. I mean, I actually, it wasn't my recommendation in reviewing the policy to delete those portions, but I understand the rationale behind it, which is to make the policy a little less kind of step intensive and to detail the individual, school's individual responsibilities and obligations in a protocol that would be district wide rather than a school committee policy. But I will say that the fourth paragraph of the plan of the prior version of it did seem to kind of automatically assume that a 504 plan will be developed for every student, which I think is an erroneous assumption.
Okay, so the original version we were working from,
Yep.
had a paragraph that assumed a 504 was,
Yeah.
The paragraph that begins at the start of each school year, the health office will provide. No, it's the one-
I think it's the one right before
The
it.
one before it.
The one that says when is determined by a physician, a 504 meeting will be convened and the 504 plan will be communicated.
Yeah.
That whole paragraph.
Right. So that is supposing that anytime a 504 meeting or eligibility determination is made, that a 504 plan will be found to be necessary and issued by the district. And that's not necessarily accurate because the team in that part of the process does need to consider the availability of mitigating measures in determining whether the student requires individualized interventions.
Okay. So deleting that is probably wise because it was erroneous.
Right.
Okay. Sorry, Sue, go ahead.
Member Valentine, I just had a question based on our previous meeting when we talked about this policy. It was determined that it was kind of implied in the policy. Wasn't really clear to us, but it was implied that everybody that had a life-threatening allergy would be eligible for a 504 plan.
Okay, so can I speak to that, Matt? Because I'm the one who spoke to that the last meeting.
Yes, we just asked.
So,
for that.
right, so basically there are two components of the 504 process.
Okay,
So there's determining eligibility to be protected by 504.
okay,
And then the second component is determining if the requirements, if the circumstances for the student warrant additional accommodations. So what I was saying was, for all intents and purposes, most students with a life-threatening allergy most likely would qualify for 504 protections. However, they might not apply, qualify for a plan because it's individualized, and we would make that determination based on the circumstances.
So thank you for the clarification. So it's kind of a two-step process. That's what you're saying. Okay.
Yes.
Okay.
And our obligation is to make sure that they are notified, that they are, notified of the process and that they are eligible to pursue that process. However, not requiring a meeting for everyone as rule. As I understand it. Okay. Were there other pieces that you had a question on? Did I miss any?
No, not really. Are you asking me that or?
Yeah, yes, since we have you
No.
here.
Not really. I mean, I just, the key is that for the U.S. Department of Education's, in assuring that we're meeting their expectations, there definitely does need to be, some reference to a provision to refer those students for evaluations of eligibility under Section 504, which the revised version of the policy will contain. So that would really be my primary concern.
Okay,
But I think that concern's alleviated by the addition of that sentence at the conclusion of your revised policy paragraph 3.
okay. And then I see that there were some legal references added, which I appreciate.
Yep. Any time you're considering any type of policy which addresses to some degree whether the student will be provided with an equal opportunity to access district facilities and programming, I would always recommend that you reference to Mass General Law, Chapter 76, Section 5, which is the non-discrimination statute.
Right. Did we not have that? I think we did in our head, so thank you. Right. Okay. Is there anyone else that has questions, or do you want to go through some of this, anything in more detail?
I think that my questions mostly have to do with wording and making sure that we are specific where we want to be and not unintentionally specific where we don't want to be, if that makes sense. So I'm just trying to scan through and just see if we had conflated the eligibility versus the team determination in any other portion. I don't think we have.
We can take a minute to look through it, or we can go through it each paragraph and just make sure there aren't any other either changes or questions that we would have as we go through it. Would that make sense? Can we? There's not really a way to make, oh, you did make it a little bit bigger on the screen.
You're looking at just
It's just hard, no, that's fine. It's just hard to see the yellow portions in the lighting that we have, I think. No, don't change it. Don't change it. Don't change it. I can see it.
I do have a question.
Sure.
So last time there was the suggestion about keeping the sentence in the event that eligibility is determined halfway through.
Is that on page 1 or page?
On page 1, if you scroll down, can you see my highlighting on the screen? No, you can't. Okay.
Yeah.
Go ahead.
I'm sorry, that was, I think that sentence was actually contained in the original policy at paragraph 2.
Mhm.
It's struck in the red line version of the policy. It appears as paragraph 4, second sentence.
Yes, which is in the event that eligibility is determined, the 504 plan will be communicated to professional staff. Yeah, that's in the part that we proposed deleting.
Right, and that is the sentence that actually somewhat presupposes that a 504 plan will be developed simply because a student's determined to be eligible for the protections of Section 504, which is not accurate.
So you're wondering if we need to put it back in, and I hear Matt saying that, the attorney McAvoy saying that we definitely should not have that sentence in because it presupposes.
So I was a bit confused. I thought that the sentence before this was the one that assumes eligibility. Because I'm reading it as, in the event that eligibility is determined, that to me means that there was a process that was performed to determine the eligibility, right? And then
Yeah.
the following parts would occur only if 504 is, if 504 plan is developed.
Right. And I think we were suggesting to strike it out because these are all part components of the 504 process that we would communicate it to all the parties working with the student. So,
Which are also governed by a specific set of federal regulations.
So it's redundant?
Well, it's sort of like whether we put it in our policy or not, it's the law, so they have to
Right.
do it.
Right.
So I guess the question is if we wish to put it in our policy regardless, just to reiterate that it is.
But I wonder if there's a way to
No.
then note that it's law anyway, because I don't want people thinking that it's something we just came up with on our own for our own policies.
So I guess my question would be is how useful is it in that position versus if you're going through 504 eligibility determination, you're developing the plan. How much more useful is it to refer back to a policy versus 504 itself? And also how often would something of this part of 504 be changed? Because if these are the same kinds of actions consistently, then I would have an easier time retaining it. But if it is something that gets reviewed frequently and updated from 504 itself, then we definitely wouldn't want to have it in our policy because we would always have to be changing it.
so section 504 actually there will be a revision coming out. I do not see that this would change out of there at all. This is just a component of the regulations that we would have to communicate it to all parties.
And is this specifically for life-threatening allergies, or any 504 plan whatsoever?
Any
Any
504.
Yep.
That part I knew.
So Maria, that's forthcoming, because I'm looking here, it says the Section 504 of the Rehabilitation Act of 1973. I mean, that's quite a few years ago. So they're in the process of reviewing this whole regulation.
I think they review it periodically anyway.
I can speak to that. They have not revised the 504 regulations in 50 years. There is a current set of revisions currently on the table at the U.S. Department of Education. Those will likely be sent to the Office of Management and Budget within the next 6 months and could potentially go into effect next year. There could be very substantial changes to the 504 procedures and as well as substantive requirements of Section 504 plans, which is somewhat of, also the thinking behind, removing some of these procedures from existing committee policies and allowing the district administration some greater flexibility through the use of a district-wide administrative protocol so that those can be quickly and easily revised to facilitate implementation of any new requirements. They are going to be significantly different.
That's good to know.
So Matt, it sounds like we're going to be revisiting a lot of our policies relative to 504 pending the release of the new.
Not a lot.
You-
No, because it's law. But I guess what I hear you saying is that this level of detail that's in this is from the law. It's part of the process as the law exists now.
Yep.
And even if this piece may not change much, that it may not be wise to leave it in because the law itself is expected to be changing in, as soon as the next school year, which would be like the summer.
Right. And you're not necessarily, students with life-threatening allergies are not afforded a different process than, other students with mental or physical impairments that could potentially be substantially changing or limiting a major life activity. So it is just a little somewhat confusing potentially for staff in implementing these policies to have, what could end up being like conflicting processes set forth in the policies. They're going to be trying to comply with the regulations.
I will say that thought process is consistent with what we've been doing with our school committee policies as a whole for at least the past few years, where there's detail about what's in a law, unless it's required, like with some of our sexual harassment and harassment policies, where it's actually required that we quote certain sections. We have been referring to the law or the policy because that way, if the law changes, we're covered versus having to redo a policy every time the law is changed or tweaked. It sounds like this will be more than a tweak, but
This will be more than a tweak. And, you guys are, just as a heads up, you're looking at the same thing with all of your sexual harassment in Title IX provisions, probably next year as well.
Okay, that's good to know. We redid a lot of those last year. So.
Oh, I know you did, and you did them, and they were in accordance with the regulations as they existed. But the USDOE has recently issued revised Title IX regulations that are currently at the Office of Management and Budget, should be released within the next, I think, 45 days, and could well become effective as of September. Again, we are not 100% sure what's actually in these changes. But they are going to be substantial and will likely impact any policy relating to sexual discrimination.
I will make a note of that. I will definitely make a note of that because I think that some of those are policies that required us by law to include things in our policies. That's a different discussion, but I did make a note of that. Go ahead, Linda.
The only other wording question I had was in the second paragraph. I would like to see some clarification in the second sentence because right now the way it reads to me is
Can you read the sentence?
the district will update and implement the allergy awareness protocol that will include, but is not limited to, education of the school community. And so this is where, to me, it reads like we're educating the school community on the allergy awareness protocol. And what we actually want to educate us all on is life-threatening allergies. So I don't know the best way to fix that. I don't know if I'm alone in seeing that as kind of a missing grammatical connection.
The next part of that sentence, so it says education of school community and training all staff, right? So isn't that the next piece of that? So we're talking about two different things.
Yeah, so are we educating the school community on life-threatening allergies and then training for all staff, emergency plans and procedures? And then those three things fit with the protocol?
Yep, so the education piece is in that group.
Right, but the way that it's stated, just in terms of wording, is that the education will be about the protocol, not about life-threatening allergies. Is that what we're educating the school community about, is about the protocol?
Yeah, I didn't read it that way at all.
I mean, what we were.
No, it's an
referencing it,
interesting, I didn't read
just
that way at all. So
interpreted as, are we having that, I mean, we want to make that.
we want to make sure it's
right?
clear, but I will entertain discussion on that because I certainly want to make sure it's clear. When I read it, I read it as I didn't read that way at all. I read it as educating, training, etc. about,
Life-threatening allergies, right? That's how.
yeah, that's how I read
That's how
it.
we discussed it. I'm just-
because that's what's in the protocol.
I just think that the grammar is not reflecting our intention.
Okay. I will entertain thoughts because I don't, as it made sense to me, so I don't know. I can't think of how to change it, so go.
So Linda, do you have suggestions?
My initial suggestion was to just add education of the school community and at that point on life-threatening allergies and then continue the list.
Um,
Do you want me to put it in?
so education of the school community about life-threatening allergies or about the individual or
No.
about life-threatening allergies in general?
So I've typed it in. I mean, I don't know if that's the right phrasing. Because
Can you read what you typed? Because it's hard to see.
Sure.
That's not your fault, that's just the way
The
it's.
district will update and implement the allergy awareness protocol that will include, but is not limited to, education of the school community about life-threatening allergies, training for all staff, emergency plans, and procedures. Does that reflect
Does that make sense to people? Yes. Is that accurate? Or what the protocol is saying? Is that accurate for what we are doing?
Or is the education about the administration of epinephrine? Because that would be the other interpretation I would take without this adding
And
that
we
clause.
can go into more detail about the education and training. Because the education will be about life-threatening allergies, about the protocol that we have in place, and about responding to emergencies, which includes.
Right.
So, I mean, it's including all of that. Those pieces.
Is life-threatening allergies a decent umbrella term for all of those things?
It's an umbrella. It's a big umbrella, right? So there's a lot of things that go under that education for those.
Is it problematic to make it that big of an umbrella?
Is it less of an umbrella than just saying education of the school community? Or is it one of those things where if we start listing things, then you have to keep listing more things, otherwise it excludes things. Whereas the way it's worded now
Right. And it's like
is more
training
open
process.
to anything.
Because the way that I'm looking at this construction is that individual phrase, it's not that, like that about life-threatening allergies is not further applied to the rest of the list. It's only applied to education of the school community. So, because that counts as all of the staff, all of the students, the parents,
Mhm.
not just the parents of the child with life-threatening allergies, but parents in general.
Other parents, like the letters we get. where they
The
say
senior
you have a-
center down the road that might be doing,
Yeah.
or the rec department that might be collaborative project. Like, that would be the school community.
Yeah. Like the letters we get that say, oh, you have a student with allergies in your classroom, please do not.
Like public notice.
Yes.
I just want to make sure that it's accurate.
Yeah.
I mean, you could potentially just add after procedures relative to life-threatening allergic conditions.
And then that would encompass all of those other pieces, like the training of
Yeah.
the staff and the emergency plans
Right.
and procedures. So if you add that at the end, like you just said, then all of those pieces will be applied, like for that umbrella of like allergies.
Yeah, I guess I was thinking that the protocol that the training directly ties to the protocol and the emergency plan directly ties to the protocol. That was what I was understanding the list as. But
I mean, all of those things are part of the protocol, right? So it's part
Right.
of.
So
Yeah,
that's
it says-
why-
it
that's why I
says-
didn't want to apply it further to the list.
It says
Only
that
that one part.
It says the district will update and implement the allergy awareness protocol that will include but is not limited to those things. So it's basically a sentence about the protocol, and then we added it will include but is not limited to.
So if
Education
nobody
training.
else thinks that there's this vagueness that I'm seeing in the grammar, then I'm happy to take it right back out. But I just felt that it was something that could be misinterpreted later.
Which we certainly don't want, so we just need to make sure we can clarify it. I don't know. So in your thought, adding the relative to life-threatening allergies at the end doesn't really solve the problem because you're seeing it as referring to the protocol, not the allergies itself.
So it's saying that the protocol will include education of the school community.
Mhm. Which it does. It does include that.
Yeah, no, but I'm not talking.
By law, it includes that.
I am only looking to clear up English as a
Totally
language.
That's fine. I'm trying to talk through it.
So education of the school, I mean, if it's not vague to other people, then I can,
I'm just
I
trying to
can take that
understand
out.
exactly what is feeling vague. And I think I'm not seeing it, so I'm trying to,
if you're not seeing the vagueness, then. it's
I'm
not
trying to
vague.
understand it because other people might also see it. So I'm just making sure that we can,
But if others are not
Make it
chiming
make
in
sense.
here, I can say that this is just a one-off here.
I can say that the education, the training, the emergency plans and procedures are also, they're in the protocol, they're also things that are mentioned in the law,
I know, but I'm
that
not, I
have
mean,
to be required. And now you're laughing because now it's
I'm
all,
like literally just talking about the words on the page, not the
Okay.
meanings behind them.
okay,
Of just how to construct a sentence.
okay, okay. So you want to know what the training is, what the community, what the education is referring to?
Because the way it's saying, implement the allergy awareness protocol that will include education of the school community.
Okay,
On what? That's my next question. We're
Okay.
educating the school community about what?
okay,
And so I look back earlier in the sentence, my little diagramming,
Yep.
and I see, okay, they're gonna be educated on the allergy awareness protocol.
okay,
That's how I'm diagramming that sentence. And
Okay.
that's the problem that I'm seeing is
Okay.
the education of the school community is
on what?
not about the steps of the protocol, but is
Right.
about life-threatening allergies as a topic.
Okay, thank you. That makes sense.
But then the rest of it is the protocol. So the protocol will include that education. It will include the training for the staff. It will include the emergency plans and it will include the procedures.
Right,
So that's why I felt that that phrase would only be applicable. The rest
To
of it
the
doesn't need
education part, okay,
clarification. The rest of it
okay.
is crystal clear that it's the protocol.
Okay. So you are suggesting that we should add education of the school community about life-threatening allergies? Is that what you said? 10 minutes
Yes.
ago?
Yes.
Okay. Does anyone object to that part? Now that I understand what you were clarifying, would anyone object to that change? Okay, so that's what we need to do to make sure we get to the right place, so, all right. Okay. All right. Is there anything else going forward in that? So does the rest of the paragraph make sense to people? Because we should change that, okay. Does the next paragraph make sense to people?
Yes, but we have to change the major.
Yes, we did do that already, I thought, in the document. May being changed to will.
It's noted, it's not actually.
Okay, so we have to change the may to will. Students will be referred for an evaluation of eligibility under section 504.
I
I don't know who's doing what.
you want me to change it?
Yeah, I don't know who's doing what, but definitely needs to change to will. And we don't have to cross it out or anything because this is a new section we're adding, so. Yeah, okay, will be referred for an evaluation under section 504. And then the next two sections we had deleted because they are all things that are included in other policies, and we just had the discussion about how the 504 is changing, and that would be in keeping with our practice to refer to the laws so that we are expected to follow the laws, but not repeat them in our policies, so we don't have to revise our policies every time the law is changed. Does anyone have a problem with anything there? Through the sentence that we kept, which says the superintendent will ensure the district physician provides each school health office with medical orders necessary to maintain a supply of all medications, including epinephrine, as well as the ability to administer the epinephrine as necessary, and the superintendent will ensure the school epinephrine controlled substance registration is renewed annually, which are key pieces of the district expectations. So I think all of that still applies. Does anyone object to that? Then we have a detailed paragraph about epinephrine that we took out because again, it is covered under our detailed protocols. I will ask the attorney, is that, you didn't comment on that part, so I'm assuming that that part is okay to take out because it is included in our detailed protocols. Is Matt still with us? Hi, oh, we can't hear you.
I turned my mic off. I didn't.
Oh, that's okay, because you're doing other stuff. That's okay. The paragraph where it says at the start of each school year, the health office will provide a list, that paragraph?
No, I think that will be addressed through the protocol.
Okay, great.
But you are referencing that you're going to comply with applicable state regulations earlier in the.
Yes, and we also mentioned that we would be revising and complying with the protocol document as well, which we
Yep.
referenced. So, okay. And then the last paragraph, next to last paragraph. We had a couple changes in it, but we did not strike the whole thing. It was about, I'll just read it. To ensure the safety and well-being of students and other individuals with food-based allergies, parents, guardians may not send outside food, candy, drink to share at school. Both teachers and parents, guardians are encouraged to recognize and celebrate students by methods that do not involve food. Any projects or classroom activities should also avoid the use of food items. Extra precautions will be taken if traditional school-based celebrations, i.e. the 8th grade cookout, dances, etc., have been permitted by the superintendent. Are there any other changes people would like to make to that paragraph? Or any concerns with that paragraph? Okay. And I didn't see any comments by Attorney McAvoy in that paragraph, so I assume that that is legally sound.
Yeah, that's fine.
Okay, great. Also, then we had a final paragraph that said all student handbook policies and statements pertaining to the support of a safe and healthy school environment should make reference to the safety and well-being of those students with food and life-threatening allergies. So that is a cross-reference that we kept in, obviously to make sure all of our policies, handbooks, etc., would include these safeguards. So. Is there anything else that people think needs to be in here that is not? Sue, you have a question?
Did we decide that we wanted to also reference our protocols?
Yes, under the legal references, we have the MGL under the Controlled Substances Act, the administration, CMR, the administration of prescription medications, public and private schools, and then the Rehabilitation Act, Section 504 of the Rehabilitation Act, 1973. We have the policies on administration of medication, nutrition and wellness. I did have a question. There's a USDA policy, USDA 7 CFR 210. Does that need to be under the legal references rather than the WRC references? And then I do hear a question about the protocol. I think we could put a link under there should be a link to the protocol embedded in the policy where we refer to the allergy awareness protocol. I think that should include a link to it at the beginning, but we could certainly put the link at the end as well. I don't have any issue with that. Does anyone else have thoughts on that?
Wherever more readily available to the public.
Right.
And we might even want to do both, I don't know.
We
Put
could
it
do
in the body
both.
of the policy.
Because I know in our
Put a link
second
and then-
paragraph, we said the district will update and
Right.
implement the allergy awareness protocol. And so I just assumed we'd have a link to it embedded in the document because the protocol might change through time and that way we would have it linked readily. But we can also put it at the bottom. I don't have any problem with that. Did you have a thought on that?
Yeah, if anything, it would be under related WRSD policies.
Okay. All right. So we'll add that.
And where did the USDA?
And would the USDA reference?
I mean,
go
that's the
under-
free school lunch reference. I mean,
So,
you know, to be candid with you guys, like I never have that much of an issue with long lists of, you know, considered legal sources in on these things. You know, it's better to have too
More than
many
one.
than too few.
right.
So if
So
you
then,
if you
but
want
this
to
would
move
be-
that up under legal references, you could.
Yes, right. So let's move that one to legal references because it's not an internal policy. And then we will add the link to the allergy awareness protocol under the WRSD policy. Does that make sense to everyone?
I'm adding that right now.
Okay, thank you.
Yeah, so I moved the USDA one up here.
Thank you. The WRC allergy awareness protocols. Okay.
I put that one first above all the rest of these. Is that-
Yes, that is great,
Okay.
actually, because that's the most important, I think. Yes, Linda.
If there's any other legal reference things you want to clear up first, I can wait.
I did not have any others. Did anyone else have legal reference questions? I think we covered them all.
Okay, so I'm just looking at the current policy and ours does not capture all of the strike throughs that we made.
Okay,
I'm sorry, I just
No, no,
know.
no, I'm saying, because we did that before, didn't we?
yeah, we did.
Yeah,
So
So
I don't
that's
know
what
what
I'm-
happened to them, but
so I can try to, it's usually kind of wonky copying and paste like from the web to a document, but I can try to put it in. It's pretty straightforward, the things that got missed.
yes, I mean, I have it in, I have a copy of the original policy in front of me, so which section?
Let's see there. So this phrase was in there. And we have it as a strike through, I think. Like that. In response to the presence of food-based allergies, was
I don't-
guardians may not send outside food candy.
Oh,
to
yes,
share in the
we did have
classroom,
that.
Right?
We did.
So we
took
took
that
out
part
the phrase in response to the presence to
Mhm.
just say.
To
blanket,
ensure, we said to
Don't.
ensure the safety and well-being of students and other individuals. Yeah.
Yeah.
That's what we said. We changed, so I don't know if that was
Right.
a change or if that was a different version, but we did say.
So that should be highlighted, right?
I don't know what
Safety and well-being
happened.
of students and other.
With food-based allergies, yeah.
And then the rest of that sentence is the same, except for where we struck that
Yeah.
in the classroom, right?
Okay.
A little less story.
That's why you should have been at our last meeting. We had that in our head. No, I'm joking. I'm just knowing the time. Is there anyone who has to leave at exactly 2:30 or do we have a couple extra minutes to finish this? Okay. I'm just doing a quick check. Because we're almost done. We've almost,
I think the
almost
rest
finished
of
it.
that paragraph is fine.
So that's the only thing we missed.
No, the second paragraph is more.
Oh, okay. The second
I'm
paragraph
just gonna, sorry, not
of the whole
second.
document?
Second from where I personally started.
Okay, all right. Okay,
So-
so go, which one?
All right, let me just see. All right. I think that we cross this out because the policy wouldn't have that kind of thing anyway. It would be in the procedures and we have policy in here.
Oh, where it talks about the student handbook, it's at the bottom,
And
the
then
district
the rest
policy
of that is-
for bullying prevention and intervention.
The rest of that is the same, right? We just struck that first.
Part about the
first
district
part.
policy for bullying prevention and intervention. And we said all student handbook policies and statements pertaining to the support of a safe and healthy school environment. Yes. Do we have? I remember discussing this.
So, yeah, no, it was just lining it up. It was because we
Yeah.
have, because that's part of the handbook.
Right. The
It doesn't
bullying
make sense-
policy.
It doesn't
yeah.
make sense to have it in the policy, it makes sense to have it in the plan. Which is just updated, and the handbook has to have the plan. So it's-
The handbook has the plan in it.
so it's redundant several times over. And not reflective of changes, but
So the handbook will have
better thing.
well, the handbook will have the
Bullying
bullying prevention intervention.
plan, which also I think has the policy within it as an appendix.
Bullying,
maybe? I'm not
what is
sure
it called?
actually.
Bullying intervention,
BPIP.
BP, yes, bullying prevention and intervention plan is in the handbook, and so that is redundant to say that. Okay.
Are the handbooks updated annually?
Yeah, they're supposed to
There's-
be.
We're in the middle of updating the handbooks. That's
It's
on the
also
list.
part
of-
of Simcoe duties.
But is our practice to update it annually?
Yes,
Yeah. Okay. Okay.
okay. All right. Do we have any other questions or about this policy as we have revised it? Do you have any other comments about things that are missing or not, or questions?
You guys don't have to take my grammar
No.
direction there.
That's okay. It's fine. We fixed it a long time ago. Don't worry.
To print.
So we're good. So we fixed it. Don't worry. We already did that. We spent 10 minutes on it. We did it. So, okay. So if no one else has any other questions about this or questions for our attorney, the attorney feels that it is sound and has no other concerns about it, which I'm taking your silence to indicate that.
Yeah, no, I'm fine with it.
Okay, that we've addressed all of your concerns. Okay. Then I would entertain a motion to recommend this policy for the full school committee. To recommend approval of this, I don't know the exact word. You're writing it out, thank you.
To recommend, not approval, was it? To recommend to the full committee the amended policy 6619. I'll put in the whole title. And the full committee amended.
And it policy 6619. For approval, is that right? Or you
Yeah,
just
for
don't need?
approval, I'll put. For approval.
Okay. And then that will be, okay, so do we have a motion?
Sue made the motion, I'll second it.
Okay, great. Okay, and then I will do a roll call vote. We have Jana,
Yes.
Sue?
Yes.
Linda?
Yes.
And I vote yes. So with that, we have 100% of us in attendance in favor. So with that, we have a recommendation to the full school committee. I will expect it to be on the agenda on the 8th. I actually already talked to Scott about that possibility. If they approve it, then the second reading would be the end of the month. Hopefully, that would be the plan. And we'd be able to have it approved this month. Can we save this version as like we did with the last one that says final version or final recommendation? I forget how we worded it. We did have some wording that we used for our last policy. I think when we renamed it, it said policy, whatnot, final. I think we named it final recommendation, and then it was able to be shared. My plan is that I will talk with Randy about a way to share this. Usually, and it would be in the superintendent's report, but usually those come out 2 days before. And we would like this, actually, they sometimes come out 1 day before. So we would like this policy to be accessible before Sunday, obviously, or at least I would. So I'm going to ask Randy if she could put it on the webpage a couple days earlier. I know she has a process for that. It's unusual that it be put on the webpage earlier. So we don't want this to necessarily be a precedent, but given the interest in this policy and questions about it, I want to make sure that people have the opportunity to send questions or clarification. So perhaps we could, or at least I could, try to find answers to them that I could then bring to the meeting. I'm
Is
sure.
there a date that we are hoping might be outside or?
I am going to talk to her. I don't know if I can this afternoon. I have a couple things I have to finish. Yes. 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 Sorry. Matt, I see you here. Do you have anything else that we would need to be aware of?
I don't think so.
Okay, fantastic. Thank you for your
Thank you for allowing me to be a resource today.
No, we really appreciate it. It was great to have you here to be able to answer our questions firsthand and talk through
Anytime.
those things. So thank you so much.
Thank you.
All right.
Bye.
Goodbye. Okay. So I don't have a date. I will talk to Randy. I don't know if it will be this afternoon because I have a couple other things I have to get done. But if not this afternoon, it will be tomorrow. And we will ask her to put it on the webpage. I also have to talk with Scott because I know that someone was concerned about starting a precedent by putting it up early, but I have been talking about that for a couple months and there was no issue raised. So I just want to make sure we have, all our ducks in a row. It may take a little bit of time to get that done, but it will be up. If I have my way, it will be up before Sunday, probably, by the end of the week.
And how would you find it, Malia?
I am hoping she can put it just under the meeting section where where she posts the superintendent reports and she posts presentations and other things. I thought that would be the most logical place because it's a meeting material.
Yeah.
And it would, go ahead.
Oh, sorry. Can Randy email the committee when it's posted and where it is?
She can, or I will, yeah.
Okay.
Yeah, so we can refer people to it.
So we're on alert.
Yes,
Well,
yeah,
just so that if
absolutely.
somebody asks, I know it's.
Yes, so, okay, yes. So do any of you guys have any other business? I did want to,
Just we are still meeting on the 10th now.
I haven't figured out that agenda yet, but that is our last scheduled meeting. So I will, did you have any questions before I know you want to see it, but that will be very soon.
And I had sent you an email about the meeting laws and getting a copy of the policy, which I requested last meeting, so I'll follow up to you and bring them that.
Yeah,
But I do have two questions and comments. One is, have you taken a look at the inconsistencies between the protocols and the policy? I know I've emailed Brittany a number of times about how I don't believe, and a lot of families don't believe the protocols are enough. And are you saying that the protocols and the allergy awareness plan is the same thing? Because I think they're being referred to as two different names in different places, or are they two different documents?
this is the policy that we talked about today. The protocol document is a separate document, but we also have reference to the legal, the law. And a lot of what was in the currently existing policy that we've amended, as the attorney just confirmed, a lot of that is actually taken from the law.
Right, no, I get that. I'm not talking about that. What's posted on the website, what was shared with families, is called the Allergy Awareness Plan. Is that what you're calling protocol?
There is you mean when the survey went out and all that?
So that's not called protocols, it's called like an allergy awareness plan. Is that one and not the same?
I believe so. I will let Amy and Maria mention that.
I'm wondering if it's listed something.
Because they sent that out because it's separate
Yeah.
from the
The
policy.
plan is what the student.
So
would essentially, right?
our protocol our protocol is like what we want all of our staff and the responsibilities of our staff members. And then their plans come from the physicians, which are their allergy action plans.
So not the health, not talking about the health plan. I'm talking about what's posted for the public on the Wachusett website. So, and it's concerning just because if you're saying you're taking these things out of the policy, we're taking procedure out of the policy, there should be consistency
Right.
in what
And what it's
families
called.
understand are their protections. And so if you go to, let's see if I can find it.
So it's under, it says life-threatening allergy plan.
Yes.
You are correct. So you are correct. It is not written correctly on that website, but it is a protocol. And in the document itself, it does say protocol.
So we need
So
to
I think
change that.
when, yep, so I think when it went out and we posted it for the families, it was labeled incorrectly. So it is a protocol, so you are.
So it's the same thing, but we need to change the name on the website.
And then in hearing all the talk about the changes to the 504 section, and in reading thoroughly the OCR guidance that came out just last month about these protections, I'm curious where the district has the required policies and procedures concerning 504s.
That's a Maria question.
Right, so that should be on our website. I say should be, because it's not currently, but it will be.
Can you tell me where that is, or could you?
No,
email me
I'm
about
saying
it?
it should be. That's
Okay.
one of the things that we've been working on, is ensuring all of our requirements for parent notice are available on the website, and we've just been continuing to update that, so.
Oh, so it's in place,
It
but
should
not on the
be.
website? Is that something you can email me?
I will send you that.
Oh, great.
And it will be
That's my
soon.
concern, that something like this, a huge protection is being stripped from a policy that's available. And I hear continuously through all these conversations, and again, I appreciate the time that you're deliberating and spending on these policies. But these are things that are the law, and the law says there needs to be policies and procedures. And what you're hearing right now is that something that's not even available to see. And that's a concern.
I know that they're working on updating Maria's whole section of the website, so I don't know where that stands, but I know you are working on it, because I've seen pieces of it. I know they're also working on updating the whole special education website, which is totally separate, but it's related. So my guess is they're both in progress, but I did make a note to check on that, and Maria is here, and she oversees the 504, so I expect that can be fixed relatively easily.
Perfect, because the policy would have to go to the school committee to be updated, so I'd imagine that would be in place.
Well, this policy has to go to the school committee. Do you mean the 504 like process? That's just the law that has to be followed. It's not a specific policy.
No, the law says that the district needs to have policies and procedures that governs how 504 is implemented. And so that's if you read the guidance that you mentioned at the last meeting.
Yes.
So
Right.
all districts need to have policies and procedures that govern how 504s are implemented.
I think we have a procedure. I don't know if we have a specific policy. I can look into that as the CPAC person as well, because I don't know I think if it says policies or procedures and we have procedures, I don't think we need a policy, but I will look into that for sure, because I don't think we have one specific to 504, but we obviously have procedures that are in line with, just like every district does, that we follow the law and we follow.
And not specifically 504, but it would fall within our policy for discrimination and harassment. It
Okay.
would be covered. 504 is included.
I'd be interested.
Okay. So you'd like to see, I'm trying to clarify what it is you need to see, so we can make sure we get it to
Discrimination and
you.
harassment, our discrimination and harassment
Okay.
policy and our 504.
Thank you. And are you able to send that?
Mhm.
Okay. Can you copy me on that, just so I have it, or send it to me separately? In case it comes up in other ways. Thank you. Okay. All right. Okay. Do you have any other questions we need to address? Okay. Thank you.
I need to. head
You
out.
need to
I'm
leave.
sorry.
So no, so that's fine. I
And then you guys
will, no, you're right, we don't. So, do we have any other questions? We do,
So
yeah.
we're- But I'm taking the minutes, so. we're-
Oh, you are, so we need to, yes, so we need to wrap up. Not a problem. I
Can I
think
make a motion to
adjourn, yes,
adjourn? All right,
please
I'll
do.
make a motion to adjourn. Second.
Okay.
No one's online?
No, so, I mean, we have this lovely checklist though. So Jana,
Yes.
Sue,
Yes.
and Linda.
Yes.
And I vote yes, so the motion passes and the meeting is adjourned at 2:43 PM. They both did. They both did at the same time.